Good afternoon, and welcome to another episode of CTLN Opinion Plus. As you know, this is a space for Latinos and their opinions and their issues and concerns. And this month is Mental Health Awareness Month. And like we take care of our physical health, it is important to take care of our mental health. And we are joined today by Luis Perez. He is the president and CEO of Mental Health Connecticut, and he's going to join us in this conversation. Thank you very much for joining us, Luis. How are you?
Oh, I'm very well. Thank you for having me, and thank you for bringing awareness to mental health. We really appreciate that.
I feel like it's an issue that is often overlooked in the Latino community, if not hidden in the Latino community. Can you give us a brief overview of the work that you do with Mental Health Connecticut?
Sure, absolutely. Let me just say that Mental Health Awareness Month was instituted in 1949 by an organization called the National Council for Mental Health, which has evolved in today's Mental Health America. Mental Health Connecticut is the Connecticut affiliate of Mental Health America, and while we're a separate 503c, we do collaborate and work with Mental Health America very closely, particularly around advocacy issues for not just the mental health of all Americans, but special populations and populations of interest, such as Latino, as you have outlined very well. It is an issue that, with many different ethnicities and races, there's a taboo about talking about mental health. So at Mental Health Connecticut, we work to promote good mental health, but we've broadened it to whole health. It's important to remember that we cannot separate the body from the mind. That we're human beings, and as such, all of our systems work in conjunction with each other. So our mission is basically to partner with individuals, families, very important, and communities to establish environments where long-term mental health and whole health, and for individuals to be able to thrive.
You emphasize the importance of an environment, of a healthy environment. What can be done to make a better environment in I guess, around the city, around Connecticut as a whole, to better mental health outcomes?
Yeah. So again, I think that if we ground ourselves, right, in the knowledge that the foundation needs to be about the human condition rather than the overall, and then from there you have building blocks, right, in order to support those individuals and individuals that may be oppressed or may be more susceptible to environmental issues. So I think good public policy that includes the recognition of oppression, the trauma of poverty, the trauma of institutionalized racism. That's a really good starting place. But then we also have to recognize that children often don't have the opportunities, right, to develop good coping mechanisms. And they may be affected by what's going on in their parents' world, their caretakers' world. And so we need to make sure that those caretakers also have the tools and the ability to be able to support good child development, so that we don't find ourselves, right, in a multi-generational piece. And that's a really difficult thing to break down, because as adults, we're much more likely to put up barriers. The stigma of mental health in the Latino community is amazing. El tío loco, and those disparaging remarks that, it may seem funny at the time, but they also create those barriers because you don't want to be identified as el tío loco. So people are not as likely to talk about it. What I am finding, and I think this is refreshing, it's that younger Latinos are much more likely to self-identify, to seek help. So I think that's turning the curve, and not being as susceptible to the criticisms of family and or friends, and the stigma of being labeled. So I see that with my nieces, my nephews, and so I'm hopeful that we're turning the corner on that.
You mentioned developing coping mechanisms.
Mhm.
For children, in a sense, we I guess one of the stigmas of
Mhm.
mental health is, oh, they had a rough childhood, or their mom didn't hug them enough. um Not that there isn't some truth to that, but
Mhm.
is there a way that we can address positive mental health, positive reinforcements with children, so that there isn't, the next generation isn't, you know uh, isn't hurt, suffering due to their
Mhm.
mother not hugging them or anything like
Mhm.
that.
Yeah, yeah. So yes, I mean, I think that listen, we live again. We talk about environments, right? We talk about environments where, and I talked about the trauma of poverty, and I'm not talking just about the poverty of not having all of the resources that you need. I'm talking about the working poor poverty. Um,
Mhm.
Many people have to hold two, sometimes even three jobs in order to make ends meet, and especially in Connecticut, where particularly housing is so expensive, and housing needs to be a foundational piece again of making sure that we create an environment that's nurturing. So rather than blaming, it's about understanding.
Mhm.
Again, back to that human condition, the barriers and the stressors that that mom or that dad or that grandmother may be experiencing at that time. And so, acknowledging that first, being able to validate the feeling rather than saying, you're just lazy, or you're just, you should have gone to school and so that you could have a better job. Rather than blaming, it's understanding it, then validating what they must be feeling like, and then exploring what are the opportunities that you may have, right, in your life, child's life, to be able to have that impact and have them feel themselves validated. Um, but I also think that we need to, and listen, a lot. My wife was an educator. And a principal in an urban setting. So we understand that schools are put upon with so many different mandates. But I do think it's important for schools to incorporate some kind of either um, uh, um, emotional intelligence curriculum, a good mental health program, through so many different uh, funding cuts in the last 10 years. We have lost a lot of the gains we had made in terms of um school-based clinics, the amount of social workers, psychologists, all the support services that children need, um, not only preventative, because I think that we need to start thinking about prevention. It is so much more expensive from a policy perspective to fund upstream services rather than funding prevention and education. And so, Mental Health America has a framework of before stage 4. If you think about, again, when most serious mental health conditions are diagnosed by age 14. What can we be doing so that there's prevention, there's early identification, and then access to services, with the hope that there'll be recovery, and that we won't find ourselves, as you mentioned, in that ongoing perpetuating, right, the stigma, and
Cycle,
perpetuating
yeah.
the
And,
suffering,
and
really.
thank you for finding the word that I was looking for, nurture. I kept avoiding me. um, my Twitter timeline is filled with people experiencing burnout in every career, in what they're experiencing every day. As a country, we have gone through quite a bit in the last year, the last 3 years, last 4 years. With this burnout happening, and I think it really has come to head because of the pandemic. How can someone seek mental health treatment if things like insurance are stopping them? Because, as you mentioned, mental health is expensive, and it's not really covered by many insurances.
Mhm, mhm.
How
Yeah,
can we how can we address our mental health without
sure.
breaking the bank?
Absolutely. And that's something that Mental Health Connecticut has actually been working from a policy perspective. 2 years ago, we were able to strengthen our parity law in Connecticut. Parity is a requirement for private insurance. We are fortunate that we do have um, uh, amongst all of the states a very robust mental health system on the public side. On the private side, unfortunately, as you mentioned, even though there is both federal and state requirements for insurance carriers to cover uh, uh, mental health and substance use services at this, using the same criteria as physical health or specialty care, that has not necessarily been the case. And often there are different limitations, requirements for um, getting approval for services, whereas when you go into your primary care physician, they don't have to call for pre-authorization to treat you, for your allergies or for whatever common quote unquote common ailment you may have. So we are in the process of strengthening that here in the state of Connecticut. I think that we've made some good headway there, and look forward to both working with the carriers as well as with the state legislature to ensure that parity is a reality, not just a concept in the law. But beyond that, there are many different ways that people can access services. Of course, you always need to start with whatever insurance you have and see whether that is appropriate. But Connecticut does have an excellent system of community care organizations, mostly private nonprofits, who again have the highest standards, and people can always reach out to Infoline 211 and find out what resources are in their community for affordable care.
Going back to the topic of the Latino community, conversationally, what can we do to destigmatize mental health in our community? Well, you mentioned el tío loco.
Mhm.
Um, what can we do to destigmatize conversationally? Do we just stop referring to tío loco? Is that enough?
That's not enough, and of course, again, cultural and attitudinal changes often are not as quick as we can, as making, getting policymakers to understand that regulation, but that also doesn't, they don't necessarily work hand in hand, right?
Mhm.
So I think that we need to do a better job of engaging natural support systems, so that, for example, faith-based organizations, we are so founded as a culture in our faith, right? Working with ministers, working with priests, working with those organizations that are faith-based around having those conversations, right? And destigmatizing. You mentioned, this year, the pandemic. Boy, as a country, as we have been thrown everything but the kitchen sink, right? Because there was the pandemic, then there was the social injustice, there was the awakening of racial and ethnic institutional injustice. All of those things have really come down, and then for those who were fortunate enough to be able to work remotely, well, fortunate enough because then now they had the stressors of managing work life, child life, if you were a caretaker for an older parent. So that's the other place where I think that we can have an impact, and that is, senior citizen centers. How do we talk about it with that generation so they're not then impacting or handing down their own biases, implicit or explicit biases
Mhm.
around mental health, right? And then compounding or shaming the younger generation around, pull up your bootstraps. When I was young, we didn't have time for cuddling and having, you're depressed, get over it, right? That's very much, the type of comments. I grew up in a very traditional family, and that certainly was not. But likewise, I think that as I mentioned, working with young people to be able to self-identify and be able to express what their feelings are without the fear that they're going to be either made fun of or dismissed.
Mhm.
Right. So again, it's that exploration, validation, and again exploration around how can you deal with those feelings in a way that is appropriate and that is also regenerative, so that when you're feeling that, I often use, and I don't mean to minimize it, but the idea of flushing the goldfish, right? What aesthetic? That's one of the first, if or whatever pet or that loss, right? That's probably one of the first things that children experience in terms of loss. So how do you turn that into, you're going to feel sad about your goldfish, but remember how, how much you enjoyed, feeding it and coming home from school and seeing it bubble up, the bubbles up on top of the bowl, and then not the toilet bowl, the fish bowl. But then using that, right, as a stepping stone, so that when they experience another loss, they're able to say, oh, this is what I did then, and that made me feel better, and I can use that skill to overcome this. So it's those conversations that I think are important, but they have to be intentional. They can't just be as part of one organization or another. So I think that we need to do a better job of doing that.
Intentional conversation. That's something to keep in mind. Thank you
Correct.
for taking the time to speak to us, Luis. I really appreciate the conversation we had.
Yeah, well, thank you so much, and I appreciate again you bringing this to the forefront, and I'd be happy to participate in further conversation. I think it should not be about Mental Health Month. It should be always, and again, reminding your viewers that first ground yourself on the condition of being human, forgive yourself, uh, do and practice self-care, and when things are not going the way that you think they should be, reach out for help. There's help out there for you.
Thank you. Thank you again for talking to us. Have a good afternoon.
Thank you. You too.
For more information about our discussion with Luis and Mental Health Connecticut, check out our web story on ctlatinonews.com and tune in next week for another episode. And don't forget to follow us on all of our social media handles on Twitter at CT Latino News and Instagram at CT_Latino News. I'm Savani Campos with CTLN Opinion Plus. See you next time.